Hi, my name is Maddie. I'm your student nurse today. May I come in?
Yes.
All right. Hi. And then I'm going to be doing your neurological assessment today. Can you just tell me your name and date of birth?
Layla Gonzalez, April 10th, 2003.
Great. And then can you just tell me where you're at?
I am at the hospital.
Great. And then why are you here today?
I'm gonna do a neurological assessment.
Awesome. Sounds good. And then can you tell me how many, or what did you have for breakfast this morning?
I had a spinach and feta wrap from Starbucks.
Sounds amazing. And then where were you born?
I was born at Kaiser in Fresno.
Perfect. All right, so we're just going to go ahead and I'm going to ask you some quick and simple questions. Go ahead and stop me if anything pertains to you. Okay, so let me see. Nope, there we go. Have you experienced any headaches, numbness, tingling, any seizure activity? How about any dizziness, lightheaded, or problems with balance or coordination?
Mm-mm.
Okay. Have you noticed any decrease in ability to smell, taste, any ringing in your ears, change in vision? Do you have any difficulty understanding people when they're talking to you?
Mm-mm.
Okay. Do you have any difficulty swallowing, loss of bowel or bladder control, any memory loss or tremors?
No.
Okay, perfect. And then, do you have any history of head injuries, any history of meningitis, encephalitis,
Mm-mm.
spinal cord injuries?
No.
Okay, and then how about stroke? Any history of strokes? Okay, and then as far as your family history goes, do you have any history of high blood pressure?
No.
Any family history of strokes, Alzheimer's, epilepsy, brain cancer, or Huntington chorea? Okay. And then are you taking any prescription or non-prescription medications as of right now?
No.
Do you have any history of smoking?
No.
Okay. And then do you consistently wear your seatbelt / protective headgear when you're doing any activities?
Yes.
Okay. And then how's your daily diet?
Good. Just eating whole foods, not staying away from processed foods. Stuff
Okay.
Like that. Perfect.
And then do you have any exposure to lead, insecticides, pollutants, or chemicals?
No, not that I know.
Okay. And then do you have any difficulty lifting of heavy objects, frequently repetitive movements, or functioning with your daily activities?
No.
Okay. And then I think that's it as far as that goes. Now we're going to start your cranial nerve assessment. The first cranial nerve is going to be the olfactory nerve. So I'm just going to have you go ahead and close your eyes and go ahead and close one nostril. Can you go ahead and let me know what that smell is?
Smells like summer.
Perfect.
Beach.
Okay. The second cranial nerve is the optic nerve. So I'm going to go ahead and test that by having you read this Snell chart. Can you tell me what that line says?
LPED.
Okay. How about that one?
EDFCZP.
Okay, and then just go ahead and read the lowest line you can.
PCT.
Perfect. Okay, and then that was testing the optic nerve. The third cranial nerve is the oculomotor. The fourth is the trochlear, and the sixth is the abducens. So we're going to go ahead and test that. I'm going to have you look straight ahead for me. Okay, we're going to test the third cranial nerve to make sure you're tracking the pen. Just go ahead and follow my pen light. Okay, third cranial nerve is intact. We're going to go ahead and test the sixth cranial nerve and then the fourth. All right, all cranial nerves are intact. Now I'm going to have you look straight ahead. We're going to check for the pupillary constriction upon light, make sure they're equally reactive and they're constricting when they're exposed to light. Perfect. Now we're going to test the trigeminal nerve. So I'm going to have you close your eyes. Let me know if you feel this sensation.
Sorry. Yeah, I feel it.
Okay. Perfect. And then we're going to test the motor aspect of the trigeminal nerve. So just go ahead and clench your jaw for me. Perfect. We have the temporal muscle contracting when the jaw is clenched. And just go ahead and clench for me one more time. Perfect. We have the masseter contracting as well. That was the trigeminal nerve. The 7th cranial nerve is the facial nerve. So just go ahead and I'm going to have you puff up your cheeks super big. Raise your eyebrows. All right, now a nice big frown. Perfect. Okay, so the 8th cranial nerve is the vestibulocochlear nerve. I'm going to go ahead and whisper in your ear. Just go ahead and repeat what I say, okay?
Okay. Go dogs.
All right.
Pride of the valley. Pride of the valley. Bright of the valley.
Perfect. The vestibulocochlear, we're going to go ahead and test the balance a little bit later on. But the next one is we're going to test the glossopharyngeal, which is the 9th cranial nerve. So I'm going to have you go ahead and stick your tongue out. We're looking for both that and the vagus nerve, the bilateral raising of the soft palate along with the uvula. So just go ahead and say ah for me.
Ah.
Perfect. And then I'm going to have you just go ahead and stick your tongue out nice and straight. Perfect. That's testing for the 12th cranial nerve, which is the hypoglossal nerve. The 11th cranial nerve is going to be the accessory nerve. I'm just going to have you go ahead and resist. Perfect. Resist on this side. And then shrug your shoulders. Perfect. That was testing for the accessories. Now I'm going to have you stand up. All right. We're going to close our eyes, keep our feet together.
Am I in the shot?
Yeah. All right. Now we're looking for any abnormal swaying. That's going to tell us if the cochlea is, or sorry, the vestibula is intact, which it appears to be so. Since you're not having any issue balancing, you can go ahead and open your eyes for me. We're going to do that for approximately 20 seconds. Now we're going to assess your gait. So just go ahead and walk in a straight line for me. All right, go and walk back. Perfect. No issues with gait. And then, oh, the last one was the sensations, right? All right, just go ahead and have a seat for me. Now you're gonna let me know if this is a light or sharp pain.
Light. Sharp. Light. Sharp. Sharp.
Okay, perfect. All right, and Layla passed with flying colors.